Hi again, I'm Ed Podlowski with Morningstar Actuarial Consulting. This is the 7th in a series of videos bringing insights into how large self-funded health plan sponsors can best assess the value propositions of innovative healthcare solution providers. Prior videos on this topic can be found at our website at morningstaractuarial.com. So today's session is really going to be part 2 of our effort to cover the many valid approaches to evaluate the value propositions of health plan innovators. Our last session focused on methods deployed where the solution has an effect on all or a good portion of the health plan such that the value is best measured by using all of the claim experience under the health plan. Solutions that only address a specific segment of the population's healthcare experience, such as emergency department usage, elective surgeries, or disease states, may require different methods. Specific approaches can include utilization analyses, price analyses, benchmark comparisons, and use of independent research studies. So utilization-based approaches review the key utilization measures that are expected to be affected by the solution for changes in the direction desired from current utilization levels. Savings can then be attributed by the change in utilization times a specified price for the service under analysis. Note, however, that utilization decreases in one component may result in increases elsewhere, so this would have to be considered in the overall analysis. Let me give you an example. Solutions that direct patients away from the emergency room for non-critical events may find an increase in utilization to more appropriate settings like the physician office visit or virtual platforms. The trade-off may still produce savings, but the shift would need to be accounted for in the analyses to assess the net results. Price-based analyses are useful for initiatives that focus on the per-service cost, like transparency tools, but don't anticipate any effect on utilization. Savings can be calculated by holding utilization constant while assessing the price difference from the intervention. Now, benchmark data may be a source for a secondary confirmation of savings resulting from other analyses already discussed, or as a substitute where the plan sponsor's data prior to the intervention is not considered credible. Benchmark data can be utilized to compare actual cost or utilization of plan sponsor after implementation of the solution against a normative database representing plan performance in the absence of the innovative solution. Now finally, research studies conducted by independent sources can be utilized where lack of any experience or data exists for a solution, which may be due to the result of a relatively newness of the product or service. So independent research analyses may not completely address the specific nuances of a particular solution, so great care is needed when utilizing this approach. The analyst would also need to understand the sources to assess the level of independence that study has from the solution. So studies commissioned by an entity that has a financial stake in a solution category, so like a business or trade association, may exhibit intended or unintended bias towards a more positive result. Each evaluation method, whether comprehensive or specific, has issues that could confound the interpretation of the results. These issues don't necessarily disqualify the approach, but it is important to consider most appropriate means to adjust the analyses and the sensitivity to the assumption. Finally, multiple methods may be considered for any particular solution, which may help support the conclusions from each analysis. Okay, so that's for now. Our last video is going to focus on validating decisions and wrap up the discussion on this topic of evaluating value propositions of innovative healthcare solutions. But if you can't wait for it, just go to our website at morningstaractuarial.com to read our article on this topic, which was published in the first quarter 2020 edition of Benefits Quarterly. The article is available under both the Solutions and News and Articles sections of the website. Again, if you want more information, please be able to reach out to me at ed.podlowski@morningstaractuarial.com or through our website at morningstaractuarial.com. I look forward to seeing you in our next weekly video.